as of this morning, we've vaccinated 41% of Denver residents who meet the current eligibility requirement. So that's real progress. We continue to have disparities by race, ethnicity, and by neighborhood. We're working hard with the city and many partners to address those. But I think it's very significant progress that we have 41% of the population who's eligible now having been vaccinated. That's an accomplishment for our community. We have more work to do, but we are on the path to getting this under control. They remain just remarkably good. And so now more than 100 million people in our country have been vaccinated with these vaccines. And I think the key thing to say is that there hasn't been any surprises. The initial results that came out back in November have just been, again, vindicated and demonstrated even more with this much, much larger use. And so they remain highly effective, quite safe, and the best tools we have to keeping our schools open and to having our communities open back up again. The clinical trials went to considerable effort to enroll a patient population that looks like the American population. That's true for race, ethnicity, for ages, and for presence of underlying illnesses which increase the risk of getting severe COVID disease. And the answer was that those were protected as well as all persons in those clinical trials. So the evidence we have, it doesn't cover every single situation, but what it strongly suggests is that regardless of age, regardless of a number of chronic illnesses, these vaccines provide high-level protection. And so I strongly recommend them to persons who are in those groups, and that they should consider themselves well protected when they have completed the vaccine series. All persons in Colorado who are 16 years of age and older are eligible to be vaccinated. We're working with Denver Public Schools and others on plans to vaccinate students who are 16 and above. We'll be developing those plans more fully, working with other partners to be able to make those vaccines available. But we're excited to extend vaccination to that age group. Of the 3 vaccines we have, only one of those is licensed down to age 16, and that's the Pfizer vaccine. It's an excellent vaccine, and so just people need to be aware it's only one of the vaccines that can be used on persons who are 16 and 17. Additionally, we expect to have approval from the FDA within the next month to 6 weeks to use that same vaccine down to age 12. The initial results of a clinical trial of youth who were between 12 and 15 years with the Pfizer vaccine were reported last week. They were excellent, very good tolerability, excellent antibody levels, and complete protection from COVID infection. So, outstanding results. We have 3 vaccines, the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson or J&J vaccine. The Pfizer and Moderna vaccines are 2-dose series. The J&J vaccine is a 1-dose vaccine. After any 1 dose of those 3 vaccines, Pfizer, Moderna, or Johnson & Johnson, there's clear evidence of substantial protection, probably about 75% protection from a single dose. That takes some time because your immune system has to respond to the vaccine. For the 2 that require 2 doses, Pfizer and Moderna, but it looks like the protection goes from 75% or 80% after a single dose to 95% after 2 doses. So with those 2 vaccines, the official time clock for saying I'm fully vaccinated is 2 weeks after the 2nd dose. Having completed the vaccine series and being 2 weeks out from the vaccine series has very clear implications. First, if you're a close contact, you don't need to quarantine. So that's very helpful and will be very helpful in a school setting. That'll mean a dramatically decreased risk of having particularly teachers and school staff be quarantined because a high percentage of them have now completed their vaccine series. So a first very important point. The second point is that the vaccines, we now have very clear evidence, protect from both symptomatic and asymptomatic infections with COVID. The CDC has put out guidelines. What they say is that persons who are fully vaccinated can gather in private gatherings, in homes, with other vaccinated persons. I had a small dinner party for a few friends over the weekend. All of them had been vaccinated. And that's very much what CDC had in mind, was private gatherings with others who are vaccinated, or a small number of unvaccinated persons who are in the same family. In public, for those of us who are vaccinated, is to continue to mask, to continue to practice safe distancing and hand washing. But again, those will be changed as case rates go down and as more and more people are vaccinated. Just to be very clear about the school setting, what that means is in the school setting, a public setting, then persons who have been completely vaccinated, right now that's school staff, we think that will soon be 16 and 17 and 18-year-old students, then it doesn't change the precautions at all. Those individuals should still mask, still practice distancing and hand washing. The key change, and again, this is an important one, is that if they're exposed, they will not need to quarantine. Symptoms that are the symptoms of an immune response are quite common after these vaccines and after some other vaccines as well. But the overall data about the frequency of those symptoms is that they are more common among younger people, probably because you have stronger immune systems. They are more common after the second dose because your immune system has already been exposed once to this vaccine. And so re-exposure prompts an even greater immune response. That's, of course, exactly what we want to have happen with these vaccines. What are the symptoms of an immune response? Well, fever, fatigue, a little bit of sweating, headache, all are quite common. And certainly pain at the injection site are all quite common. The vast majority of the people, those respond within 24 hours or within 48 hours. It's very unusual for them to go beyond that. And so what we tell people is to know about those, to know that they don't indicate something's going wrong, and yet they may indicate the need for some planning, to plan to be able to not work the day after a second dose, for example. Certainly not going to occur in everyone, but it will occur in some. Those immune system activation side effects are common, should be expected, and usually resolve quickly if they occur.